All right. As you know, I'm a limb girdle muscular dystrophy patient. I was diagnosed with muscular dystrophy in 1954 and have been pretty much independent up until this last 8 years or so. At that time, I started losing strength fairly quickly, and I was able all that time to buy anything I needed because I had good jobs. But as I lost the ability to make a living and had to go on to a long-term care, disability, and Social Security, the purchase of medical equipment came more and more into Medicare. Up until about a year ago, I slept in a regular bed, but I started having trouble turning over in bed while I was sleeping. And it got so that it would take me 10 to 15 minutes to turn from one side to the other. My doctor decided that it might be a good thing to have a hospital bed where I could have something on each side that I could hold on to and help pull myself around. So he gave me a prescription for it, and I took it to the health care provider that I had always used. And he said, and they said that the bidding process had gone through and they did not get the ability to sell hospital beds. Well, I could understand that, but I asked, who can I go to? Mm-hmm. And they said, well, we don't know of anybody in Denton County that got the ability to sell that type of equipment. So they suggested that I go on to their website and write that up, and on their website and that's where you found it. Mm-hmm. What I wound up having to do was I bought a used hospital bed off of Craigslist, and that's now what I have.
Prior to the competitive bidding being initiated, did you have one provider that you guys used for all of your needs that you had?
Yes, we did.
They, the ones that we've used in Denton, they have been very good about trying to help us with what they could do. Mm-hmm. It has been very hard trying to get like home health care. When we finally really looked into it, because it became harder and harder to move him. Even though we have a lift and we have the chair, and we now have a commode that lifts up, so that helps him. It still was hard, and there were times that I just need to break. But to get home health care, Medicare would only do it like 3 months. Well, he's surpassed over 50 years of what originally they said he would survive. So that was a joke for us,
The provider that we used have become friends, and if I break something or it's just no good anymore, they will loan me equipment free while they fix or repair it, because they're friends. Mm-hmm. And I like using them. I could use somebody else, but there's nobody else. The only other provider that I know of in Denton is a good provider, I guess, but they don't have the repair facilities that ours does.
Mm-hmm. Is there a provider in this local area that's still able to help you with any of your needs, or are you basically have a provider that's farther away now because of the contracted bidding?
I do not know of another provider anyplace that I could go to.
Okay.
There's no list available that I know of providers for certain types of equipment.
Did you?
I received a letter saying that, from my provider saying that they were not able to do that, but not from Medicare. And no, I didn't get a list.
Okay.
Competitive bidding is something the government likes because it's the least cost. It also is the least service in a lot of cases. You can't expect to buy a Cadillac for a Volkswagen price. And when you try to force providers to do that type of lowballing, you pay for it by not having service, by not having dealers, by not having the ability to help the people who need it most.
It's very frustrating to try to help him and not feel like anybody else is there.
My name is Joseph David Sanders. I'm a 71-year-old man who has had muscular dystrophy for 65 years. I've grown up and lived a fairly normal life.
I'm Beverly Ann Yates Sanders. I've lived most of my life in Texas, in the Fort Worth, Dallas area, and we were blessed with 2 children that we adopted because of the MD, to keep them from having it. And God just blessed us with 4 grandchildren, and if it weren't for my kids and my grandkids, there'd be times I'd just give up, but I keep going because I know, they're there.